The source of a medical problem is the patient themselves. So I had plenty of those who actually wanted surgery. I was the TMJ surgeon in Nashville with 2,000 temporomandibular joint cases under my belt at the time. But I would bring these ladies in. It's 90% females, 10% males, and so it's mostly females. And I bring these ladies in, and instead of telling them what kind of surgery I thought was the right thing to do, I said, tell me all about it. I want to know what you think about it. I want to know what makes it better, what makes it worse. What does your husband think about it? Does the dog bark when it hurts? What phase of the moon is it? I'll listen to whatever you can tell me about this problem. I want to know everything you know. And out of 24 women, half of them, roughly half of them, 12 of them said, if I put my finger, a pencil eraser, my tongue, a piece of cloth between my front teeth and gently bite down, it feels better. So I made a device that did just exactly that, something that they could put between their front teeth, but they could keep between their front teeth and talk with between their front teeth and would be comfortable between their front teeth. You just can't eat with it, so you got to take it out to eat. And that was the beginning of the solution, because after I did the first one and gave it to the first lady and said, keep it in your mouth for 3 weeks, come back in 3 weeks, use it 24/7. Except when you eat. And when I walked in the room 3 weeks later, she looked up at me and she said, thank you, doc. My pain is gone. And she had 20 years of headache, earache, jaw pain. Now, you've heard me say this story before multiple times, but the point is, this is describing how to think, okay? You've heard the story before. I don't mean to repeat myself. Apologize. But we're talking about how to think a problem through. So, in this case, I used inductive reasoning. The solution was actually given to me. I was given the key. I was pointed in the right direction. And I tried that out inductively. And then after I found out that I had a patient that it was successful with, I did 20 or 30 more, and also found out that rapidly that disparate symptoms began to decrease in each and every one of those follow-up patients, at which point I had 25 or 30 patients under my belt, and I did not know how it worked, which then I went back to deductive reasoning. And I went back to the books, and I started looking at data points.